One of the biggest health stories of the week was the FDA approval of a new nasal spray for the treatment of severe depression. The nasal spray is for people who have tried other antidepressant medicines but have not benefited from them. It is estimated that approximately 1/3 of U.S. adults with a major depressive disorder have treatment-resistant depression. Joining me right now to talk about this, the drug and the new question surrounding a key ingredient is Dr. Jack Gillean. Good morning, Dr. Jack. One of the things that I really find encouraging about this is ketamine is something that was used for other things, but now they're repurposing it to give people relief.
That's right. Yeah, it was used historically as an anesthetic, mostly for children, adolescents who are undergoing like bone marrow biopsies, that kind of thing. And yeah, they've realized over the years that it actually has some benefits to people who have depression, and especially people who have not responded, like you said, to previous antidepressant medications.
Walk me through that. You know, you go to the doctor and you have depression and it gives you something like Prozac or Zoloft or something like that. Sometimes it just doesn't help at all.
Correct, yeah. Some people don't get a significant benefit from the medication. Other people just don't tolerate the medication. Side effects can be problematic, so that's a rate limiting factor for a lot of folks.
Ketamine is a nasal spray, this new thing. How long is it available now, or is it coming? Is it going to be available soon?
Hopefully soon. Yeah, Johnson & Johnson is working on making it widely available to patients, but right now, you know, they have to work with the insurance carriers to make sure that they will actually reimburse for the drug. So there's some logistical things that need to be worked out, but we're hopeful that it'll be available pretty soon.
Depression is such a serious thing. You hear people who, you know, cannot get relief. Do really, you know, bad things sometimes, including taking their own life. So do you think this is going to help more and more people?
That's my hope, yeah. You know, I work for a practice here in Oakland. We have 5 offices in the Bay Area, and we specialize in treatment-resistant depression. So we work with some of the sickest depressed individuals. And yeah, our hope is that, you know, this will be another tool that we can offer them to help them get better. You know, there are some limitations. It seems like there's not great durability potentially with ketamine, but we also offer a treatment called transcranial magnetic stimulation that has better durability. So our hope is that we may be able to use this in combination with a treatment like that to get people better faster and keep them better for longer.
I've heard about Special K. It's like a party drug,
Sure.
and you know, people have been taking it. What is it? Why were people taking it illegally before they went to the club or something? What does it make them feel like?
Sure. So it has some dissociative and hallucinogenic effects that people enjoy. So it has been used historically as a party drug, and I think that's something that prescribers have to keep in mind when prescribing the drug.
Abuse?
Exactly, yeah, there is abuse potential. So I think patient selection is going to be very important, you know, making sure we're not treating patients who are drug seeking or who have a history of substance dependence. But I think, again, when we're dealing with potentially fatal illness, you know, that risk may be significantly outweighed by the benefits of the medication.
The drugs that I mentioned before, Prozac and Zoloft, are they stimulate the place in the brain where you feel good to make it, you know, really plain for people. Does ketamine work differently?
It does, yeah. It has a very unique mechanism of action. So most traditional antidepressants are working on monoamines. So serotonin, norepinephrine, these are neurochemicals that affect, you know, mood regulation, anxiety tone. Ketamine works on NMDA receptors, which is a completely novel mechanism of action as far as antidepressants are concerned.
So if someone, maybe someone's part of the SSRI isn't responding, this will go a different way. In other words, taking a different route to get to the same place?
Exactly, yep. That's the hope, is that, you know, by using a different pathway, a different mechanism of action, we can help those individuals who are not helped by the currently available treatment
Are you
options.
encouraged by this?
I am. I'm very encouraged. Yeah, I'm excited for my patients and hopeful. Yeah.
All right. Thank you for coming in, talking about a very important topic. Mike and Garcia.